we have a platform that makes surgical teams way more efficient, reduces errors, improves business relationships with vendors, and supports positive patient outcomes through smart contracts enabled through our platform. And so what makes our approach really unique is that this is, like we mentioned before, built on 30 plus years of working in this space. So we really do understand our customers' problems innately. Smart contract technologies provides autonomous capabilities for these tasks and reduces non-clinical burden on healthcare workers. So what that means for them is a faster, more accurate experience with a lot less headaches in their workday. And above all, everything that we do is really centered around patient safety, patient privacy, and patient outcomes. Good afternoon. I'm John Hatchell, co-founder and CEO of TYDEi Health. I'm happy to be with you all today to explain to you how we're trying to solve challenges in healthcare that myself and my co-founder have either observed or participated in the past 30 plus years of our experience with healthcare customers through the medtech industry. And so to do that, I want to walk you through a little bit of an experience of what most folks in surgical services are dealing with today. So if you're a surgical staff member today, some of the things that you might hear folks say are, did we put all these stickers on the charge sheet because I need to fax this over to a vendor so we can get our replacement product for tomorrow's surgeries? If you work in finance in some type of surgical facility, some of the things you might hear these folks say are, do you know which products we're using in the surgery for this patient? Because we don't have a record, and we have vendors hounding us for purchase orders again. And then if you're the vendor sales representative who's kind of tasked with the quality control of managing these devices, some of the things you might hear these folks say are, I promised all these implants were here for that patient on Friday, and now I'm missing products for the case. Do you know if it got used over the weekend? And really all this is done to do is a little exercise to show you that until now, procuring and purchasing physician preference medical devices for surgery has been a really friction-filled process. And so it's filled of time-consuming paperwork, really bad data and processing of information, way too much guesswork, and you can probably guess the result. Over $1 trillion spent in administrative costs annually, $40 billion in waste tied to invoicing, $5 billion in erroneous payments tied directly to pricing accuracy due to contracts. And then we've got 80% of our healthcare facilities still using paper-based processes. And this pertains to transaction statements, invoices, and checks. And so our business at TYDEi Health is this. We have a platform that makes surgical teams way more efficient, reduces errors, improves business relationships with vendors, and supports positive patient outcomes through smart contracts enabled through our platform. And so what makes our approach really unique is that this is, like we mentioned before, built on 30 plus years of working in this space. So we really do understand our customers' problems innately. Smart contract technologies provides autonomous capabilities for these tasks and reduces non-clinical burden on healthcare workers. So what that means for them is a faster, more accurate experience with a lot less headaches in their workday. And above all, everything that we do is really centered around patient safety, patient privacy, and patient outcomes. And so the ways that we're trying to impact care are around these 4 pillars. So digitization, really digitizing every paper-based process that we interact with, automation, automating administrative processes that really overburden healthcare workers in their day-to-day, safety, validating that products are indeed safe for use in patient care, and transparency, providing 100% transactional visibility in these really necessary business-to-business relationships. And so from our platform, what folks in healthcare can expect is full line of sight for supply chain, an end-to-end commerce solution, the ensuring that their vendor contracts will be adhered to standard, patient privacy and data protection, product safety and compatibility, providing an internal messenger suite so that these folks who really do work in a matrix, department to department, have the ability to communicate, especially with sensitive information in an area that is a little bit more controlled, full enterprise visibility, and then real-time data dashboards that give these folks all the actionable insights they need on what's happening within their organizations. We're particularly bullish on the ASC market right now. As many of you may or may not know, the ambulatory surgical market is exploding right now, and there's a real opportunity here for us to disrupt the current incumbents by providing consolidation. We've observed up to 11 to 12 healthcare IT systems being used in some of our customer discoveries with ambulatory surgical centers today. And so right now we are out seeking to raise $3 million in our seed round, really to hire the technical team that we need, business development folks, and then the account implementation teams necessary to facilitate a lot of what's needed in our business models. A lot of this is committed, so looking forward to finding other folks to add to the cap table. And really what we're trying to do is get everyone to understand that we've got a unique opportunity with TYDEi to really be the core, the hub here as far as a system to provide the value, efficiency, transparency, and collaboration that's truly being missed today, especially in the needs of surgical services. Thank you for your time.
So can you tell us a bit more, I think it'd be helpful for background, what's happening in the ASC market and why that's such an immediate opportunity for you all?
Yeah, so the thing that's happening right now is that we've seen a large shift of surgical volume that's moved to the ASC space, particularly because of the opportunity for surgeons to diversify their revenue streams. So they can have the opportunity to have equitable arrangements in these ASCs that provide them with the opportunity to have ownership now and capture facility fees. So this obviously in certain specialties has driven a lot of these specialists into these arrangements. These trends will probably lead to surgery being taken out of the hospital setting and move into the ASC setting. Upwards of almost 70 to 80% of all procedures being done in an outpatient setting in the next 10 years.
It's a big shift.
It's a large shift.
It is a large shift. It makes a lot of sense it's going that way. You talk a lot about patient safety. So how's your system contributing to safer patient experiences?
Yeah, so we're able to use smart contracts to essentially be the last line of defense before products are opened and utilized in a surgery. And right now, the only last mile for quality control or for product compliance is the human element. So this is a really exciting opportunity, to provide some digital, safeguards and digital checks and balances on product before they're actually opened and utilized in a procedure. And it's actually pretty shameful to think that in this day and age we don't have any real technical barriers for these products before they're used.
That is a little alarming when you think about it. Question from an attendee: is your product something that's integrated into existing purchasing software?
Yeah, so it's front end and back end integratable. So obviously we interact with surgical scheduling data from an EMR, and then on the back end we interact with the ERP systems or a general ledger, depending on the account itself. So fully front end back end compatible. Certainly in certain organizations there may need to be certain customizations dependent, specifically the ASC space where they rely more on a clinical management software solution as opposed to a general EMR.
And I was going to ask you about just the general competitive landscape. And then there's a question here: why are you better than the Omnicell system?
Well, from a smart contract standpoint, we're providing autonomous capabilities for all this non-clinical workflow. There's plenty of healthcare IT systems out there that handles certain elements of supply chain. We don't really consider ourselves a supply chain software solution. We are a third-party manager, and the problem is there's so much nuance there in how these folks interact with their healthcare customers that really is kind of a black box. I would say that we're the first void filler for this space, particularly, which is a $200 billion market that is exclusive and specifically designed to handle these surgeries and everything that encompasses them.